So in today's conversation, we will talk a little bit about our CAN community. Then we will jump into the famous speed networking, where you will have the time to interact and connect with each other. After that, we will have our guest speakers, Siraj Wikali Dunda, who is a data scientist at the Kenya National Bureau of Statistics and a CAN partner. After Siraj's presentation, we will have Elishama Yomi Adbajor, who is an impact research data analysis for WeTech Foundation and a former CAN fellow. Then we will have time for Q&A, and at the end, I will invite you to explore some of our opportunities to join the CAN network. So I just wanted to let you know, so Ms. Alan is here. All of you have your microphones disabled. So if you would like to speak, please raise your hand, and raise your hand feature in the reactions menu toolbar. You can share any questions in the Q&A box. And also, please use the chat to introduce yourself. Let us know your name, organization, and where you're joining us from. So with that, we will introduce you to the CAN network.
Should I share the video right now?
Yes, please.
The Capacity Accelerator Network is all about making sure that we have the right skills in the right place to tackle some of the biggest challenges that governments and civil society organizations are facing.
The Capacity Accelerator Network is a really important program because then it's providing the opportunity to provide experiential training.
The eventual goal of CAN is that we've built up this massive partnership of all these institutions that are working on climate and health data, and people's lives are actually improving as a direct result of this fellowship. Tools that were being used, for example, the use of QGIS. QGIS is a mapping tool that can be used on any other use case. It must not just be on this. Is that these skills can be applied not just to land degradation neutrality, but also to other use cases.
Our major title we were doing is the carbon emissions in the transport sector. And our main objectives was, first of all, to get to have enough data.
We were very new. Actually, we were starting as a unit, and Agnes brought a light in what we were doing.
Notre cas d'utilisation portait sur la cartographie et l'analyse des données de la dégradation.
La RDC a bénéficié du programme CAN.
Nous avons encadré ces boursiers dans la réalisation de son objet d'étude et il a travaillé dans le cadre de l'évaluation des données de dégradation de terre.
Now I have a lot of skills in GeoLDN tools, and I can support partner organizations and other organizations that are also championing land degradation neutrality.
When we got the opportunity to put in a fellow, Clement was the one that was assigned to the authority, and Clement developed the database.
During my fellowship, I always shy away from any project that involves spatial analytics. So we have to use machine learning to put the data together and then be able to predict cholera cases for each ward at a given time.
With the help of the fellowship program, we're being trained on the GeoLDN toolbox.
CAN gave me an opportunity to make an impact to my country.
One of the things that's most exciting working on climate data and health data, some of the solutions that we're seeing and the analysis that we're seeing is starting to mirror people's actual lives. And that is a tremendously exciting thing to see and to be part of.
What an inspiring work this is. Thank you, Shivan, for showing us that. So as you hear, the Capacity Accelerator Network is a network of networks, and we also have a global community. So we created CANversation as a flagship community called series for CAN. So with the purpose to foster an inclusive and engaging space for knowledge exchange, collaboration across regions and roles, showcasing impact and success stories, amplifying the diverse voices, and strengthening connections among our global partners. In our community, we are dedicated to providing a harassment-free, inclusive, and welcoming environment for all participants, regardless of gender identity or expression, age, sexual orientation, disability, physical appearance, body size, race, ethnicity, nationality, religion, socioeconomic status, or education level. We prioritize the safety and well-being of marginalized individuals and communities over the comfort of those in position of privilege. Maintaining this integrity and inclusiveness of our community is a shared responsibility. So thank you so much for being part of our community. Now let's connect. We are going into our speak networking time. We are heading into the breakout rooms for 5 minutes. In just in a round of introductions and try to connect. In your window, you will see, in your screen, you will see a small window asking you to join the breakout room. So please hit the button join. And after 5 minutes, we will bring you back into the main room. As an icebreaker, I would like you to share one example in your community where data has helped address a climate issue that was impacting people's health. We will share this question in the chat, so let's go to the breakout rooms. Welcome back, everyone. I hope you got to meet some new people and fellows in our CAN community, and you also hear from interesting examples of how we are using data at the intersection of climate and health to improve people's life and health as well. So with that, I will share my screen. And now we can move into the main section of our community call, which is our guest speakers. So I would like to introduce you to Sarak Wikali Ndunda. She is a data scientist and a statistician at the Kenyan National Bureau of Statistics. He leads the modernization of official statistics using artificial intelligence, big data, and digital platforms. He also oversees multidisciplinary teams delivering key national innovations, supports regional and global capacity building in data science, open data, and modern statistical methods. And she's a coordinator of the Young Statisticians Program, also advocates for youth advancement in data science. So Sirak, welcome. Over to you.
Thank you so much, Diana, for the opportunity. And as you've done most of my introduction, so I'll not go through that again. So I would be talking about use of data at the intersection of climate and health to drive social impact in Kenya. I want to put it in the Kenyan context, what's being done in Kenya, and basically the lessons we have learned, and also the challenges we are facing and the limitations. And I also want to bring how that is also reflecting the impact of CAN in the training which we had, because we had a fellowship training during CAN session in 2023. Yes, so can I have the first slide? So I work for Kenya National Bureau of Statistics. This is an introduction of the organization I work for. And Kenya National Bureau of Statistics is the principal government agency, and we are mandated to collect, compile, analyze, and also publish statistical information on behalf of the government. So we are the National Statistics Office for Kenya. And our vision is to provide quality statistics for better life because people rely on the statistics we produce for decision making and policy making as well. And our mission is to provide, manage, and promote quality statistics through utilization of best practices for public use. We have the core values which guide the institution, and that includes professionalism, integrity, confidentiality, customer focus, innovation, and teamwork. Next slide. So these are the points of what I'll be talking about. I'll try to explain further. So the intersection of climate and health in Kenya. So what is Kenya doing about the intersection of climate and health in the country? So the country has national policy and strategy, which create demand for the integration of data. And for that, we have National Climate Action Plan, and we also have Kenya Climate Change and Health Strategy, which are established for the mandate of joint risk assessment, surveillance linkages, and also mainstreaming climate consideration in health planning. And these instruments also create institutional demand that drives system change at the ministry and at the county level. In Kenya, we have two levels of government, national and the county, where we have 47 counties. So these frameworks are used in both national government and also at the county level. The other one is operational early warning systems that fuse meteorological and epidemiological data. And for that, we have Kenya Meteorological Department, which has collaborated with the Ministry of Health and research partners, such as Cambridge. And they have come up with malaria prediction, which is early warning system to mitigate the high risk. And for this, they have put in consideration rainfall levels, temperature, environmental factors, which also contributes to high risk of malaria. So in the system, they have put environmental conditions to model prediction of malaria. And in that way, they are able to tell the areas and the counties which are prone to malaria outbreak before it actually happens, which is more like instead of being reactive, we are going proactive way. And we also have integrated climate signal into our routine health information, district health information system. And with that, it means that we do not have to keep on reinventing the wheel and coming up with different systems. Instead, we just integrate the climate signals within the already existing health information, district health information system. And with that, we have been able to come up with use cases, which we are still exploring. And that means we are focusing on moving towards the right direction with the system integration. We have also we have cross-sector partnerships and One Health approach. What this implies in our Kenyan context is that we have partners which have come together, and this means that we have our researchers, county government, and meteorological department working together, and we have also international partners who have enabled data sharing across human, animal, and environmental domain to be available when needed. And that means that at the end of the day, if we have this data available, it's available for research.
Sarah, you're on mute.
Oh, sorry. Okay, so we are also actively tracking SDGs, SDG 13, which is climate action. For that, we are tracking 6 indicators out of 8. One of them is not applicable in our context. That means that we are only remaining with 1 indicator, which we are not reporting. And the goal, which talks about health, that is goal 3. We are reporting 17 indicators. We are actively monitoring and reporting the 17 indicators. And also another goal which relates to climate and environment is clean water and sanitation. And we are reporting all 6 indicators, meaning we have covered all the indicators which are relating to clean water and sanitation. You understand that clean water and sanitation is cutting across both health and climate, right? So that the 6 indicators. And we have heard the lessons which we have learned as a country when we are doing the modernization efforts. And one of them is policy mandate translates into technical work and funding priorities. So when you do not have these policies and strategies, then you may not be able to know where you are going to invest your resources in terms of technical capacity and also the infrastructure. So these policies, they also guide in funding and also making sure that the technical work is properly distributed. Also integrating climate into existing health rather than creating parallel system. That means saving funds as well, and also making sure that you do not have a lot of systems in place, which most of the time means duplication of efforts, and also meaning more investments in terms of human capacity and infrastructure as well. Operationalizing forecasts with simple decision-making rules, meaning that we are able to forecast some of these instances before they happen. Now talking about malaria, I know most of countries and especially people I'm talking to may not know what malaria is, but malaria is a big deal in my country. So being able to mitigate malaria before it actually happens, it means we're saving more lives, because for the longest time, malaria has been the biggest threat in this country. And open statistics and interoperable metadata amplifies impact. Now, having these SDGs available and accessible, it means that we are able to communicate the impact of what we are doing as a country, and we are not afraid of telling the world exactly what's happening in our country. And we have capacity building is very important. For us to be able to coordinate both at the levels of government, we need to capacity build the county level as much as we are doing in the national level stuff. The key limitations we have encountered so far are limited peer-reviewed impact evaluation, which is a very important thing we need to do. Data quality and reporting timeliness. You find that for us to do all this, we need timely data, and most of times we need real-time data, which sometimes is a challenge to get. And also interoperability governance. So we need to have legal frameworks which also govern how we share data and all that. And how these experiences connected to capacity accelerator network in strengthening data use for climate and health decision making. You realize that during the time when we were being trained, our theme was around intersection between climate and health data for decision making, which means that the training came on time for us, and especially for Kenya National Bureau of Statistics, where we got a lot of staff trained. So while other countries were getting 5, we got 7. We were favored a bit. And that means that being the National Statistics Office, we are able to compile the data and avail it in the way which is needed, and we are working with the other government institutions to make sure that we are able to provide the data when they need it for decision making. So basically, that's what is happening in Kenya. I hope I've kept it time. I've tried my level best, and thank you so much.
Thank you so much, Sarak, for that great and inspiring talk for all the other countries that are joining us here. I do understand. I think all of us, most of us understand a little bit what is malaria and dengue because that's the burden of living in a tropical country like ours. It happens the same in Colombia. And thank you so much for sharing the importance of having integrated data for decision making in public health because people relied on statistics for decision making. So I did love that quote that you said. Thank you so much for that. Next, I will invite Elishama. Oh, where's my, sorry. Yeah. Next time, I will invite Elishama Yomi Adbajor. Elishama is a data scientist that works on strengthening data-driven decision-making across finance, research, and sustainability sectors. She is dedicated to applying analytics for social good and equity outcomes. And she is a former fellow whose work, she's going to tell us a little bit of her work, but she demonstrated the power of data to inform health and climate resilient strategies. So welcome, Elishama. Over to you.
Thank you, Diana. Hi, everyone. Good day. So I'll be talking about mostly my work during my time as a fellow, and then, some of the lessons and how that can interplay generally into how we solution for climate health challenges in Africa. So a bit of context for the fellowship. I was paired with a host institution in my country. I'm from Nigeria, and the context was that they wanted us to work on assessing the influence of climate stressors on mortality for Nigeria. And so I think the first thing that stood out to me when I started out the work and, I was talking with sickle cell patients was the burden in terms of lived experiences. So statistically, we know that, yes, Nigeria has the highest burden for sickle cell globally. And we have about 4 million people, 4 to 6 million people, estimates give, that have sickle cell disease. And of that number, you have 1 out of every 4 Nigerians that actually have the sickle cell trait and can pass it on to the next generation. So these were numbers. I was familiar with them. But interviewing and speaking with sickle cell patients made me realize how much deeper the impact is on people's personal lives. So I had one person tell me about when he was a child and first one major experience that stood out for him. So he said during his time in primary school, I think that's about like elementary school or so in the global north. So he said during his time in school one day, after the close of school, there was a brief drizzle, some rain, and then the children gathered outside to pluck fruits from the trees, and so he joined them to play, feeling he could be normal like every other child. But that night, the effects of that rain and the cold had seeped into his bones. He had severe pain and landed in the emergency ward and realized that life was different for him than for everyone else. And that's changed how he was able to manage his risk going forward. And he said as time went on and he grew up, he even noticed things like the seasons changing and Hamatan playing hide and seek with us. Today we know, okay, it's showing up in November, December, and next thing we are seeing it's January, February. And so all of that shifting shifts in the weather conditions, those were things that also showed up in the data when I started to work on this. Another thing that stood out for getting data and delivering the work, which is what I've termed here as the CAN solution, was that data was sparse. We were not able to get granular data. We couldn't even get hospital records that were unified, that could, where they've tracked cause of death and all of that. And so we had to make use of IHME projections. That's the Institute for Health Metrics and Evaluation. And we use that to build a model. To first of all, see the influences of certain parameters like temperature, precipitation, aerosol optical depth, which is basically an indicator for particulate matter or air pollution, and see how those interplay with the estimates for mortality across different countries. So because we had no granular data, we had high level country yearly data, we had to work on modeling for African countries and then generate synthetic augmented data to be able to drill it down to have like monthly estimates. So the map you see is showing the distribution of the output of our modeling and forecasts for 2026 to 2030. And you can see the distribution in terms of the strengths of the estimated influence of climate on mortality. And so there were some clear patterns that we saw. For instance, there were certain climate stressors that affected mortality or were associated with mortality trends much more than others. So we saw, for instance, that with West and Central Africa, there is a much higher burden in terms of climate sensitivity. And then for some parts of East and Southern Africa, we noticed that for cooler months, they were aligned with higher mortality risk. And so one of the learnings we took is that, and even in how we modeled, was that this isn't like a single story for Africa. There's definitely regional differences, and it changes not just by the region, but also by the season. And rainfall was like the strongest indicator expectedly, temperature as well. And even in some small way, air quality via the aerosol optical depth that was measured also played a role. And so even in sparse data context, we're still able to, make something useful that could inform early warning, inform national planning, and all of that. Okay, please, the next slide. Okay, thank you. So the major thing here is that strong data roots are what will inform, the models that would actually be more useful. I have here like a tiered structure to show what this actually looks like in practice. So it starts with reliably capturing data at the front lines in hospitals, in clinics, in community, building those systems. Today in Africa, we have a lot of data applications and solutions to solve or tackle climate health challenges. And there's a lot more in terms of how rich this could be in terms of usefulness and application once we get our health data system strengthened. There's a lot of funding going into, climate data and all of that. Climate data wasn't hard to find in this particular case, but the health data itself was what wasn't collated in a structured way. I had one NGO founder tell me that there's no way you're going to get that data. At best, it's just those who use health insurance, and that is tracked based on, okay, they need to get an approval before their health treatment is done. So that's the only level of documentation. And that in itself is still in silos. It's not coordinated. So data partnerships and strengthening at the health data systems needs to be done on the ground level for that to now inform availability, accessibility of regulated open data systems, and for that to now translate into amazing applications. And so I put together a list of some solutions, some examples of some amazing things that are still happening in Africa, for instance, and that have shown great impact. So for instance, there is a monthly climate health bulletin that's done in Madagascar that helps people know, okay, this is when we're going to have like increased climate sensitivity, and these are the diseases or health issues that are going to be of most impact, and so people can plan towards that. The DHIS 2, which Sarah also mentioned, is an amazing place to also start. They have a climate data app that has regional data and district level data on a lot of climate parameters. And even Uganda has leveraged that, for their suitability mapping for malaria, where they're able to combine both climate and environmental thresholds to determine when they would have like different levels of mosquito or parasite survival. And these have informed, district level weekly assessments in that area as well. And even in Senegal, there's a health early warning system that, informs even down to shepherds, so they know when to move their heads. They don't move their heads during hot months, but they have that system that informs them. It has also translated into their medical system in Senegal being better prepared. And recently this year, Nairobi has deployed their first network of, city-owned real-time temperature and air quality monitoring sensors. And I couldn't help but highlight here the work that the Africa Climate and Health Capacity Accelerator Network is doing. This has shown us that at the level of governments and social impact organizations, there's a lot that can happen in terms of how professionals are trained and equipped, and even evidence-based solutions can have shown great results in terms of dramatically or drastically turning the tide with regards to these climate health challenges that we have. So the goal is for us to start where we are, is for us to build our systems, our data systems from the ground up, and rely on our partnerships and use our strong data roots to create amazing applications. Thank you. Thank you. And I look forward to questions later on.
Thank you so much, Elishama. It's very important for us to understand the importance of interoperability and coordination within the data systems, which is what's going to give us some sort of help and solutions for improving people's life in health. Thank you so much for that. Before going into the questions and discussion time, I would like to invite you to, if you want to know more about what is CAN Africa, what is the CAN Africa Network, how it works, do you want to know more stories about our African fellows, do you want to see some impact stories and impact metrics and also some lessons learned, I invite you to download and read the Africa CAN Playbook, which was launched a few months ago. So please do so and let us know what you think about it. So now we have some time for questions. You can place your questions in the Q&A box, or you can also raise your hand and ask the question yourself. Please let me know. I don't see any questions here or here. Yes, Arman.
Yeah, thanks, Diana. I think, yeah, first of all, thank you for this very detailed presentation. And I think a lot of factors that we talked about here are also true for a country like India, so where we are working as CAN fellows. So my question was, for like both the speakers, and if any one of them can answer that, in your experience, what do you think at what levels, right? Such kind of data integration systems work, where you integrate climate and health data, right? Because that's a question that we are also asking ourselves right now, that whether you need a hyper local level, which is like at a city or a sub-city level, or do you think in your experience, like it's much more better when you do it at like a county or a district level, or a larger regional level, or maybe we can also say talk about the national level, right? So just wanted to understand that, do you think that there is a use case for each level integration, or do you think that it's more better at hyperlocal, or like a more broader level integration? So yeah, I hope my question was like I was able to put my question straightforward. Yeah, thanks.
Yes, Armand, thank you so much. I think that's a question for Siraj, who manages the statistics of Kenya. Siraj?
Yes. I think integration is based on the need. I usually tell people innovation is not for fanciness or to look like you are good, you are out there, it's to solve a problem. So the question is, what do you want to solve? What is the problem? And now, when you identify the problem, then you will know how to solve the problem. So the question is, what are you trying to solve with integration? And after you've gotten now the problem you want to solve with the integration of the systems at your country, now you'll ask yourself, how do you integrate? At what level do you think your country will benefit? Because at the end of the day, you are not the one who's benefiting from the integration of the system. It's the entire country, it's the policymakers, it's the researchers, it's everybody who is interested in the data. So that one is based on the need. And the other one is based on the infrastructure. So what infrastructure do you need for integration and what is available? Because you cannot use what you do not have to solve a problem. So you have to work with the resources you have to solve your problem. So if you can be able to identify that, then you will know at what level the integration will help your country. Thank you.
Thank you, Tarak, for that. Any other questions? I think I saw another hand. Maybe Sheena, was it?
Yeah, but I mean, it was very similar question I had, which Arman already asked. I got the
Okay,
answer. Yeah.
perfect, thanks. We have another one from Sally here. And it says, call Sirag to speak briefly on how the KMBS is collaborated with partners to track SDGs.
Okay. So when it comes to tracking SDGs, we majorly rely on data from other partners. 65 of our data actually comes from administrative records, meaning that we have no choice apart from working with ministries, agencies, departments, and county government. So we have to come up with a model of which we have to make sure that we include all of them. And how this works is, first of all, bringing them and having stakeholder engagement, trying to bring them on board about what is the SDG, why is it important for them to provide data for SDGs. And that way now you can be able to collaborate with them and have them share the data with you so that you can be able to update your SDGs. We also get data from civil society. We are advocates of use of citizen-generated data to bridge some of the data gaps we do have. And that's because we realize that we have a lot of duplication of efforts with the limited resources we have. Today, you'll go and find civil society collecting data on education. They have invested in that. And then tomorrow you find another government institution collecting the same data from the same people. And so at the end of the day, you have the same data from the different organizations. So we came up with a criteria for validating citizen-generated data and making it useful for official statistics reporting, so that you don't have to go over and over again doing the same thing and complain that you still don't have money. And also, we also have to collaborate, of course, with institutions where we collect data from, because we also collect data from institutions, that is surveys, especially from private sector. Private sector sharing data is not easy. So we have to collaborate. And for private sector, we have to come up with agreement, data sharing agreements, and we also we have signed MOUs, memorandum of understanding, so that we have a gentleman agreement between us and them, that when they give us their data, we are going to take care of it, and we are not going to share their confidential data because of private sector is competitive. And so we are not going to share it out, which can also paralyze their businesses. Yeah, so that is how we collaborate with partners to track SDGs.
Thank you, Sarah. I think Sally has a follow-up which question. It says, also, how has this experience been specifically for counties, considered not only approximately 9 out of 47 counties have published the county statistical abstracts?
Actually, we are the one who help the counties to publish county statistical abstracts. We check through the entire process, and that means we don't rely on the county directly for the data because we also get data from government institutions which are based in the counties. For example, we have health, which is devolved, and health works with the Ministry of Health at the national level. So we will not need to go and ask the county to publish their statistical abstract for us to be able to access that data because you can still get the county data from the ministry. You realize that even after we have devolved some of the functions, we still have the institutions at the government, at the national level, which are handling the devolved functions. So at the end of the day, whatever information we need from the smallest administrative unit, we are able to get it at the national level because of the network we have at our country, whereby we have the county governments and it's working with the national governments through the ministries.
Thank you, Sarah. And thank you, Sally, for your question. We have another question here. Oh, I have another question, and it's about, let me pull it up. How do you ensure that these data-driven insights translate into real improvement for the local community? I guess that's a question for both of you, Alishama and Sarah, because sometimes we have all this data, we have interoperable systems, but how do we ensure that this is something that is real, making an impact on the community?
I would like Elishama to speak first because I've been speaking. It looks like I'm dominating.
Okay. So I'd say from my perspective, two things. One is co-creating the solutions to start with. I see sometimes researchers or technology innovators just come up with data solutions on their own and feel, oh, this is my perception of the need. But when you go down to the grassroots levels and have those engagements, it helps you, know what's actually needed and what would work, and to iterate and refine as you go on. And also a mixed methods approach. Sometimes it's not always just about the quantitative data. The qualitative data matters as well, knowing the why behind the situation and tailoring your solutions to actually help that in the long run. So that's my take.
You're mute, Sarah.
I'm sorry, I don't know why my computer keeps on muting me. I was thinking, Diana, you're doing it. But now I think it's my computer which has a problem. So we have Kenya Institute for Policy Research Analysis, which is basically the institution which is responsible for advising government when it comes to policy making. So how we make sure that this data is used, we share our reports. Actually, before we even release our reports, we call the key stakeholders for engagement, and we have this conversation about the data, the reports which you are releasing, and how they can use them. And one of the stakeholders we bring on board is KIPRA, which is the institute which is responsible for policy advice. And once they are there, now we are sure when the policies, they will come up with policy briefs, policy recommendations based on the data which is available. We also have engagement with Parliament caucus. So though that is not the parliament, but that is the body which we trust to go and be able to engage our parliament on how these reports we produce can, and the data we have can be used for policy and decision making. So I feel like we have that advantage given that we are a government institution whereby we can be able to engage government institutions directly and have them now consider what we are producing in their policy making. Thank you.
Thank you both. We have a questions, I think, is for Elishama, and is were there any surprises or lessons learned about your process that you could share?
Okay. So yes, there are definitely lessons learned, and I think part of it is what I shared about our approach, and sometimes need to pivot when you realize that the initial problem or the way it was framed isn't how it is in reality, or you do not have the resources or data, or there are limitations to achieving that. So that's one thing I learned, being able to work with what's available. And then also for me, the experience as a whole, the CAN fellowship has contributed to my career in terms of how I think about sustainability of the work I do and impact, and how this actually goes to help people. So yes, it has shaped my lens, and yeah, those are some of the lessons learned. Thank you.
Thank you, Lishama. And we have time for the last question is, what did you do or would recommend to others to build partnerships to support your work? Any of you, Sarah or Elishama?
Okay, what we did, okay, I believe this is in relation to a capacity accelerator network, if I'm not wrong. First of all, it's self-drive. I think one thing which made us to go through the entire training is because we were determined, and you don't rely on another person to have impact on you. This is more like a self-initiative. So you have to be the drivers of the process. Yes, we were given a fellow to come into our office and work with her, but then we did 90% of the work. So at the end of the day, what I learned and what I would advise anybody is that take it up. It's yours. You're the one who's learning, and you're the one who's going to implement. And you can't rely on another person to drive or rather to drive the process for yourself. Thank you.
Well, thank you so much, Nelly Shama. I think just to wrap up, I like to highlight the importance of data-driven programs like the CAN Africa, to help us understand the effects of climate variability and the challenges that it represents for the health of the population. For that, we need the communities to be represented. We need to work with the communities, as Elishama said, with co-creation. And also we need partnerships, but as Sirat remarkable say, we need assistance response with data-driven decision making. So thank you so much for that. Now I'm going to invite you. I'm going to share with you some training and participation opportunities that you have with the CAN network. So let me share my screen. So as you know, we have a global community, and each of our hubs have a lot of training and participation opportunities. And this time, as we are talking about health and climate, I would like to invite you to these free to access courses, which are within the platform of data.org. One of the courses is data analysis for climate and health. So you can learn everything about data analytics that Serak was telling us. And we also have the data storytelling, which is for health focused on climate communication. So they are free to access. You just need to go on the data.org platform. You also have the links to access these courses in the chat. So please go and train yourself. and undertake these courses. As data.org, we would like to invite you to join the challenge to build AI that empowers people and communities. This is an active artificial intelligence challenge between data.org and Zoom. And we are seeking out projects that drive AI workforce development and organizational capacity. We are looking for AI applications that empower people and communities to unlock resources and economic opportunities. So if you want to apply or know the requirements for application of this AI challenge, we will have 5 hour list. So you can go in the website and look at all the requirements for application. It's also in the chat. And before we go, as the time is ending, I would like to thank the 100+ partners that we have with the Capacity Accelerator Network. It's been a great year for us to work with you, and we hope you keep working with us in the coming year. If you would like to be featured, reach out to us at info@data.org. We would like to hear from you. We want to amplify your work and help you to connect with other people in the network. So with that, I say thank you so much, everyone, for participating. Thank you so much, Sirak and Elishama, for telling us your story. And have a happy new year, and we will see you in 2026. Bye-bye.